Here at Drew Dental, we offer each patient an individualized comprehensive plan to replace one or multiple teeth with a wide variety of options ranging from removable appliances to conventional fixed appliances to implant-supported dentistry. We see many patients who fracture their teeth, and many times they're fractured to the point where we cannot fix them. So the ideal solution is to have that tooth taken out and have a single implant put in its place. You could also have a conventional bridge, which was the state-of-the-art 30 to 40 years ago. The issue that arises with that is if the neighboring teeth don't have a restoration in them, we essentially have to cut those two teeth down to a point where they always have to be crowned. From now until the day the patient leaves this earth, they have to be crowned. The other thing that we see is people come in and they've been missing one or two teeth in a row, and now they want to replace the missing segment of teeth. And what we can do in that case is with 2, possibly 3 implants, depending upon how many missing teeth there are, we can have implants placed and replace that with a bridge. And regardless of what option the patient chooses, we try and idealize their occlusion and try and bring the patient back to the point where they have a full complement of teeth, which is what they came in for. By maintaining what they have and providing for the missing teeth, they're able to maintain their dentition for the rest of their life. And when they leave our office and they leave here, we have a big mirror by the door, and when they look in that mirror and they smile and they turn to the ladies at the front desk and they say, "That's why we came here."